Dr. Sassani.
Sassani, okay?
Right.
And you are, you speak Spanish too? Somebody told me. A little bit?
Yo puedo hablar español un poco.
Un poco. We're going to speak English anyways for the broadcast. Tell us a little bit. First of all, thank you so much for sponsoring this fantastic event.
Absolutely. It's an honor and a privilege to be here to honor the Hispanic women of distinction.
And you are in charge of getting us all beautified.
Absolutely. It's not just cosmetic. We do a lot of reconstructive surgery as well.
Tell us a little bit about your clinic.
About
your clinic, what you do in your clinic?
Well, I've been in practice in the Plantation, Fort Lauderdale area for about 20 years.
Okay.
And I trained up at the University of Pennsylvania in Philadelphia and came down here in 1995, and I never looked back. I've been here ever since then.
Wow, wonderful.
Yeah, and the clinic itself, we do a wide variety of cosmetic procedures and a lot of reconstructive surgeries, breast cancer reconstructions, skin cancer reconstructions, facelifts, eyelids, brow lifts, tummy tucks, breast augmentations, reductions, lifts.
What is
the full gamut of plastic surgery.
So you go there and you get all ready to go to Miss Universe?
From head to toe.
What is the age when we talk about, because now there's a lot of maybe younger people doing surgery. Do you recommend, or what is the limit?
Well, I mean, there is no specific age limit, but as plastic surgeons, we typically operate from head to toe on babies all the way up to people that are into their 80s, 90s, and beyond.
Okay.
As far as cosmetic procedures, most people do it in early adulthood for things like breast augmentation, and then we do mommy makeovers when people have had their babies.
Ah, wonderful.
And then when women get into their 40s and 50s, then we start talking about facial aesthetic procedures.
Okay. What is the one that everybody, I mean, we have the tummy tuck, but there's one that breast augmentation will be the favorite one?
Breast augmentation is the most common procedure nationwide.
And what about for Latino women? Is the same situation?
Probably about the same, yeah, breast augmentation.
When you, I was going to your website, you are certified. What is the difference being, part of the American Certified Association as a surgeon?
Right. It's important when someone is looking for a plastic surgeon that they make sure that their physician is board certified by the American Board of Plastic Surgery.
Okay.
That really sets the gold standard for verifying a surgeon's credentials and their ability to do all these types of procedures.
Exactly.
Anybody that's a physician can call themselves a cosmetic surgeon, but not everyone is a board-certified plastic surgeon. So it's important for patients to do their homework and make sure that they're going to someone qualified.
What is the procedure to go to your clinic just to get a consultation? Maybe some people are hesitant, they don't know. Can they just go and talk to you about it?
Absolutely. They call to make an appointment. Our consultations are free, and we spend as much time as we need to with the patient to make sure they understand all the procedures that they're interested in doing.
Okay, perfect. And also, there's one thing that maybe a lot of people that are listening, that are Latinas, going to another country to do surgery.
Right.
What do you think about that?
Well, I try to discourage people from doing medical tourism because you don't really know what the qualifications are, or you can have complications and you're far away from home.
Okay.
So it's not always such a good idea to go so far away and have major surgeries because complications can happen.
Exactly.
And then when you come home, a complication can happen too, and it's very difficult for you to jump back on a plane and get back to the country where you had it done.
So you don't touch them. If somebody, what is your perception about the whole thing? People come, they have a situation, you have to go back to that country where you came from?
Obviously, if it's a life-threatening situation, obviously we try to triage them and take care of them. But the problem is that if it's a major problem, then that problem becomes your problem.
Exactly.
Yeah, but we don't turn our back on people. So if they have a problem that we can readily fix for them, we try to do what we can.
Okay, so somebody's have a situation, they can go, maybe if it's something life-threatening, they go to 911, first of all.
Exactly, they will go to the emergency room.
Exactly.
And then there's always doctors that are on call too, so if it is something that's very, very serious, they're going to be taken care of.
But do not recommend it at all. It's the best thing to do it here because, we have
the unfortunate thing is that a lot of times people shop price and they don't shop quality. So it's important to go to someone with proven results and that have good outcomes.
Exactly.
And so that's why I normally encourage people to do their homework, investigate their doctor, go to that doctor's website, and if he doesn't have good before and after pictures, then he's probably trying to hide something.
That must be a hint right there. What about men? Do they do surgery too?
More and more commonly, men are getting procedures done because they're competing in the workforce with younger guys, so they want to look as good as they can. So they're getting facelifts, they're getting their eyelids done.
Exactly.
Yeah.
What is the period of time after you do surgery depends on what you have done
The period of time
to get
for
back on,
recovery?
Yes.
Recovery for most procedures is typically about 4 weeks before they can resume normal activities, running, jogging, or heavy lifting. Most people are out of work for about 10 to 14 days for most procedures. If they're not taking medications or pain medication, they can go back to work and start driving.
Okay, fantastic. What about the prices? It depends also? I know
yeah,
a lot of people
obviously-
want to know that.
Well, if they want to know the prices, I would encourage them to come in for a free consultation.
There you go.
Because prices do vary. It depends on the complexity of the operation and how many procedures you do at the same time.
And what about the financial situation?
We have financing available in the office.
Okay.
So we have some very good financing programs, Care Credit, and there's one that we use.
Okay, fantastic. I think we cover a lot of the things. Do you want to send a message to the Hispanic women that are listening, and also to all the honors today, because we are celebrating our journey, we are celebrating leadership. There's people here that from education, health, politics.
Well, I just want to say, what an honor it is for us to be a sponsor. And just talking to some of the Hispanic women that have stopped by the booth, it's very empowering to hear some of their stories. And it's a very vibrant, amazing group of women. And we're very proud to be a part of it.
Thank you so much for what you're doing, and thank you so much for getting all beautiful.
Yeah,
all
thank
the women
you.
around South Florida, and I bet from all over the country they come to your office.
They do. I get patients from all over the world, actually.
Well,
So we're making the world a more beautiful place, one patient at a time.
Exactly. I like that slogan. Are you using it? Tell us the name of the website so people want to look for information.
It's www.takeshape.info.
Thank you so much.
Thank you very much.